distinguished guests, delegates, good morning and welcome to the 2025 World Bio Summit. This World Bio Summit is co-hosted by the Ministry of Health and Welfare of the Republic of Korea and the World Health Organization. Before we proceed any further, allow me to introduce myself. I am Lee Seung-hee, and today I've granted the honor of serving as your Master of Ceremonies today. On behalf of the organizers, first, I'd like to extend my sincere gratitude to all distinguished guests, speakers, and panelists for joining us today. Held at the Seoul Silla, the World Bio Summit 2025 brings together the Minister of Health and Welfare of the Republic of Korea, ministers and vice ministers from around the world, leaders of international organizations, academic experts, and CEOs of pharmaceutical companies. This year, we will engage together in meaningful discussions under the theme, From Innovation to Access, Health Innovation for Everyone, Everywhere. This marks the fourth edition of the World Bio Summit, and we look forward to continuing the dialogue that will further strengthen global biohealth this year as well. The summit officially begins today with this opening session, followed by 3 main sessions. In addition, a variety of side events will be held on the 3rd floor, covering diverse topics and providing additional insights for our attendees. Finally, the summit will conclude with the closing session, which will provide a comprehensive summary of all sessions and their key outcomes. Ladies and gentlemen, before we begin, please note that this event is being streamed live. You can join us through the official website or on the YouTube channel of the World Bio Summit 2025. So we look forward to your active engagement and participation, and also hope that you find all sessions today both insightful and engaging. Then now, without further ado, let us begin the opening ceremony of the World Bio Summit 2025. Thank you very much. And ladies and gentlemen, first and foremost, we'd like to take a few minutes to introduce our distinguished guests who are joining us here in this room. So once I mention and introduce their names, please welcome them with a big round of applause. First and foremost, we'd like to welcome Her Excellency, Dr. Chung Eun-kyung, Minister of Health and Welfare of the Republic of Korea. Let us welcome her with a big round of applause. Thank you very much. Next, Mr. Park Joo-min, Chair of the Health and Welfare Committee of the National Assembly of the Republic of Korea. Thank you. His Excellency, Dr. Mustafa Ferzani, Minister of Health of the Republic of Tunisia, is joining us today. Let us welcome him. Thank you. Mr. Eduardo Pedrosa, Executive Director of the APEC Secretariat. Let us welcome him. Next, we are joined by His Excellency Mr. Khalid Al-Budikan, Deputy Minister for Health of Kingdom of Saudi Arabia. Let us welcome him. Thank you. And next, please welcome His Excellency Mr. Tri Tuc Ung-yen, Vice Minister for Health of Vietnam. Next, His Excellency Mr. Penioni Lavnawa, Deputy Minister for Health and Medical Services of Fiji. Welcome. Next, please welcome Dr. Cha Sun-do, President of Korea Health Industry Development Institute. Let us welcome him. Next, please join me in welcoming Dr. Han Sang-won, President of National Academy of Medicine, Korea. Please welcome him. Next, let us welcome Dr. No Yeon-hong, President of Korea Pharmaceutical and Biopharma Manufacturers Association. Let's welcome him with a big round of applause. Thank you. Last but of course not least, we are also joined by excellencies, our ambassadors from State of Kuwait and United Republic of Tanzania, along with the 20 representatives of diplomatic missions. Thank you very much for your participation and support. Let us welcome them with a big round of applause. Thank you. And ladies and gentlemen, please understand that due to limited time, we could not introduce each and every one of you who are joining us today. But thank you very much for your support and participation. With that, to officially open the summit, we're now honored to begin with the opening remarks from Her Excellency Dr. Chung Eun-kyung, Minister of Health and Welfare of the Republic of Korea, the host of this event. Ladies and gentlemen, please join me in welcoming her to the stage with a big round of applause.
안녕하십니까? 대한민국 보건복지부 장관 정은경입니다. 2025 세계 바이오 서밋에 참석해 주신 세계 각국 정부, 국제기구, 민간단체, 기업을 대표하는 전 세계 리더 여러분들을 진심으로 환영합니다. 한국에서 뵙게 돼서 반갑습니다. 대한민국 정부와 함께 2025 세계 바이오 서밋을 준비해 주신 세계보건기구에도 깊은 감사의 말씀을 드립니다. 코로나19는 인류 전체에 있어서 큰 고통이었지만 다른 한편으로는 보건 분야 글로벌 연대의 중요성을 확인할 수 있는 좋은 기회였습니다. 이러한 공감대를 바탕으로 2022년 처음 개최된 세계 바이오 서밋에서는 서울 선언문을 채택하며 국제 보건 안보 공조 체계에 대한 로드맵을 구축하였습니다. 2023년에는 이러한 논의를 더욱 구체화하여 실질적인 팬데믹 대응 역량 강화 방안을 집중적으로 논의하였습니다. 지난해에는 안전하고 건강한 미래를 위한 투자 방안으로 아젠다를 확대하면서 세계 바이오 서밋을 한층 미래지향적인 소통의 장으로 발전시켰습니다. 그리고 오늘 우리는 혁신에서 접근으로 모두를 위한 의료 혁신이라는 주제로 다시 이 자리에 모였습니다. 그동안 인류는 눈부신 기술 혁신을 이루어왔지만 이제 중요한 과제는 그러한 혁신이 실제 누구에게 어떻게 닿을 것인가 하는 문제입니다. 의료 혁신의 결실을 일부 국가에만 국한해서는 안 되며 지리적, 사회 경제적 장벽을 넘어 전 인류가 함께 누리는 보편적 혜택이 되어야 합니다. 이러한 취지에서 올해 2025 세계 바이오 서밋에서는 모두를 위한 의료 혁신의 핵심이 되는 의료 AI, 에이지 테크, 바이오 클러스터 이 세 가지 주제에 대한 심도 있는 논의가 이루어질 예정입니다. 먼저 의료 AI는 의료 서비스의 생산성과 효율성을 획기적으로 개선하여 의료 자원이 충분치 않은 지역에서도 양질의 의료 서비스를 누릴 수 있게 하는 의료 혁신의 중추입니다. 이와 더불어서 에이지테크는 기술을 접목한 돌봄 서비스를 통해 어르신 한 분 한 분이 독립적이고 품격 있는 노년을 누릴 수 있도록 하는 포용적 기술의 핵심 열쇠입니다. 마지막으로 바이오 클러스터는 의료 AI, 에이지테크와 같은 최신 기술을 실증할 수 있는 환경을 제공함으로써 다양한 혁신 기술이 대중으로 확산되는 연결고리의 역할을 합니다. 현재 대한민국은 빠르게 초고령화 사회에 진입하면서 만성질환 등 의료 수요가 증가하고 있고 지역의료와 필수의료 부족 등 다양한 보건 문제에 직면해 있습니다. 한국 정부는 이에 대응하기 위하여 지속가능한 보건의료 체계로 전환하는 한편 특히 AI, 바이오 등 혁신 기술에 과감하게 투자하면서 보건 문제에 대한 새로운 해법을 찾아가고 있습니다. 필수 의료를 지원하는 AI 솔루션 개발과 현장 실증 지원 등 의료 혁신을 위한 AI 투자를 확대해가는 한편 건강한 노화를 실현하기 위한 에이지 테크도 육성하고 있습니다. 또한 여러 바이오 클러스터의 기능과 자원을 연계하는 버추얼 플랫폼을 구축하여 클러스터 간의 긴밀한 협력으로 시너지 효과를 창출해 가고자 합니다. 한국 정부는 의료 혁신의 고삐를 늦추지 않으면서 그 혁신의 경험과 결실을 전 세계 이웃들과 나누어 가겠습니다. 나아가 세계 바이오 서밋이 전 세계 보건의료 분야 리더들이 모여 최신 지식과 담론을 공유하는 글로벌 협력의 장으로 자리매김할 수 있도록 꾸준히 힘쓰겠습니다. 다시 한번 아름다운 가을날 대한민국 그리고 2025 바이오 서밋에 발걸음해 주신 여러분들께 감사의 말씀을 드립니다. 짧은 시간이지만 대한민국에서 즐거운 추억을 만들어 가시기를 바랍니다. 감사합니다.
Thank you very much, Minister Chung, for your leadership. Thank you. Ladies and gentlemen, once again, please join me in giving her another big round of applause. Thank you. Thank you very much for sharing meaningful words that remind us of this year's theme. Thank you once again. Up next, we're honored to present the opening remarks from Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization. While Dr. Tedros is unable to join us here in person today, however, he has shared a video message for all of us. Ladies and gentlemen, please draw your attention to the screen.
Honorable Minister Dr. Jong In-kyung, distinguished guests, dear colleagues and friends, I thank the Ministry of Health and Welfare of the Republic of Korea for inviting WHO to co-host this year's World Bio Summit. Every year, millions of people suffer or die because they lack access to vaccines, medicines, and other essential health products. Many are produced by a small number of manufacturers, increasing the risk of shortages and inequitable access. In the face of these challenges, WHO is working to expand local production. In 2022, we launched the mRNA Technology Transfer Program, which is now sharing technology from its base in South Africa with a network of 15 partner countries. In 2023, we established the WHO Biomanufacturing Workforce Training Initiative, including the Global Training Hub for Biomanufacturing in the Republic of Korea, which has helped to train over 7,000 participants globally. This year, the World Health Assembly adopted the historic pandemic agreement, which includes provisions to enhance sustainable and geographically diversified local production and the transfer of technology and know-how. This year's summit provides a platform for the public and private sectors to foster collaboration and drive inclusive innovation. I thank the Republic of Korea for its global health leadership and commitment to equity. Kamsahamnida. I thank you.
Thank you very much. Thank you very much to Dr. Tedros for sending this meaningful message on the importance of our cooperation in global health. Thank you. And we'll now move on to the congratulatory remarks. First, it is my great honor to invite to the stage Mr. Park Joo-min, Chair of the Health and Welfare Committee of the National Assembly of the Republic of Korea. Let us welcome him to the podium with a big round of applause. Let's welcome him.
안녕하십니까. 대한민국 국회 보건복지위원회 위원장 박주민입니다. 먼저 2025 세계 바이오 서밋의 개막을 진심으로 축하드립니다. 이 자리를 마련해 주신 대한민국 정부와 세계보건기구에 깊이 감사드리며 전 세계 각국에서 귀한 걸음을 해주신 보건부 장차관, 국제기구 수장, 바이오 기업 대표, 전문가 여러분들을 진심으로 환영합니다. 오늘 이 서밋은 건강 증진, 위기 대응, 기술 혁신이라는 인류 공동의 과제에 대해 함께 해법을 찾고 협력의 길을 여는 뜻깊은 자리입니다. 특히 올해 주제인 혁신에서 접근으로 모두를 위한 의료 혁신은 혁신이 소수의 특권이 아니라 모두의 권리가 되어야 한다는 시대적 요구를 담고 있다고 생각합니다. 지금 우리는 고령화, 신종 감염병, 기후위기 등 복합적 도전에 직면해 있습니다. 하지만 동시에 의료 인공지능, 차세대 백신, 바이오 클러스터와 같은 혁신적 기술과 협력 모델이 새로운 가능성을 열고 있습니다. 혁신이 실험실을 넘어 현장으로 그리고 일부가 아닌 모두에게 다가갈 수 있도록 법 제도와 국제 협력이 뒷받침되어야 할 때입니다. 국회 보건복지위원장으로서 저 역시 국경을 넘어 바이오 헬스 분야의 연구 개발, 인재 교류, 규제 조화, 공정한 접근성 확보를 위한 제도적 기반을 마련하는 데 최선을 다하겠습니다. 오늘 이 자리가 세계 각국의 지혜와 역량을 모아 모두를 위한 의료 혁신의 여정을 더욱 앞당기는 출발점이 되기를 기대합니다. 다시 한번 세계 바이오 서밋의 성공적인 개최를 축하드리며 함께해 주신 모든 분들의 건강과 건승을 기원합니다. 감사합니다.
Thank you very much. Thank you very much once again to Mr. Park Joo-min for sharing your valuable remarks. Thank you. Ladies and gentlemen, next we're honored to invite His Excellency Dr. Mustafa Ferjani, Minister of Health of Republic of Tunisia, to deliver his words of congratulations. Let us welcome him to the stage with a big round of applause.
Thank you. Excellency Dr. Jong Eun-kyung, Minister of Health and Welfare of the Republic of Korea, distinguished delegates, ladies and gentlemen, it's a great honor for me to take the floor today and to represent the Republic of Tunisia at this important edition of the World Bio Summit here in Seoul. Allow me first and foremost to express my sincere appreciation to the government of the Republic of Korea for the warm hospitality extended to my delegation and for the excellent organization of this summit. I would also like to pay tribute to Korea's outstanding leadership in biotechnology, digital health, and medical innovation. We particularly commend its strong commitment to global equity and its concrete efforts in supporting technology transfer to countries of the Global South. This year's theme, From Innovation to Access, Health Innovation for Everyone, Everywhere, reflects the most urgent challenge of our time. The most advanced AI algorithm or biotechnological breakthrough is of little value if it does not reach the patient who needs it, whether in capital city or in a remote village. In Tunisia, we have embraced this mission with determination. With Health AI, our national teleradiology network now connects regional hospitals to expert specialists. This year, we inaugurate our first fully digital hospital, extending advanced care to underserved communities. We are now expanding this model into ophthalmology and pathology so that digital transformation truly reaches every citizen. Tunisia and South Korea share the conviction that artificial intelligence can transform healthcare in the service of citizens. In this spirit, we propose the creation of Tunisian-Korean Center of Excellence in Artificial Intelligence and Health. This center would serve as a true catalyst for innovation for our two nations and for the African continent. Its objectives are clear: research and development, co-developing AI tools for diagnosis, telemedicine, and precision medicine, training, offering certified programs for doctors, engineers, and researchers, incubation of startup by Tunisian and Korean talents. Tunisia brings its strategic position in Africa and the Mediterranean, its recognized medical and technological expertise, and the experience of its startup already active in. For its part, Korea is a global leader in digital technology and AI. This jointly funded center, managed by a mixed steering committee, will be the digital bridge linking our two nations and opening the way to wider cooperation across Africa. It's a unique win-win opportunity that will position Tunisia and Korea as pioneers of AI in health. Excellencies, we also believe that innovation must not only be adopted but also produced and shaped by developing nations. That is why Tunisia is proud to announce the creation of GMP certified biotraining center. This hub will serve Tunisia and our neighbors across Africa with the mission of training, transferring technology, and building regional capacity in bioproduction. This vision aligns perfectly with the spirit of bioclusters discussed here in Seoul. By linking clusters across continents, from Asia to Africa, we can move beyond isolated progress to build a truly global innovation ecosystem. Tunisia stands ready to connect its emerging hub with Korea's advanced clusters, accelerating access and strengthening health security. Another great challenge unites us, the rapid aging of our populations. Tunisia, like many nations, is facing this demographic transformation. We see immense potential in age tech solutions, from robotics to AI-assisted home care, helping older adults live longer, healthier, and more dignified lives. We look with admiration to Korea's pioneering work in this field, and we are eager to develop joint initiatives to adapt age tech models to African and Mediterranean contexts. Together, we can answer that longevity means not only more years of life, but also more quality of life. Excellencies, our conviction is simple. Technology must be the great equalizer in healthcare. To achieve this, developing and emerging nations must not remain passive recipients, but become active partners. We therefore call for concrete mechanism of technology transfer, stronger capacity building for institutions and workforce, and the creation of regional hubs for training, research, and production. Tunisia is committed to this vision, and we invite all partners to join us. Ladies and gentlemen, we are not here only to present our achievements, we are here to build bridges. Tunisia invites you to partner with us, invest with us, and innovate with us. Let this summit be remembered not only for its brilliant discussion, brilliant organization, but for the concrete cooperation it inspires between Korea, Tunisia, Africa, and the world. Together, let us answer that the marvels of health innovation, whether in AI, hashtag, or bioclusters, become a reality for everyone, everywhere. Thank you.
Thank you, Minister, for coming all the way here at the site to celebrate this meaningful event. Thank you very much. Ladies and gentlemen, last but not least, we'd like to invite Mr. Eduardo Pedrosa, Executive Director of the APEC Secretariat, to deliver his remarks. Let us welcome him to the stage with a big round of applause. Please welcome him.
Good morning, Minister Jong Eun-kyun, Mr. Park Joo-min, Excellencies, distinguished guests, colleagues and friends. It is an honor to join you today at the World Bio Summit here in Seoul. On behalf of the Asia Pacific Economic Cooperation, or APEC, I extend sincere appreciation to the Ministry of Health and Welfare of the Republic of Korea and the World Health Organization for convening this important event. We meet at a time of pressing challenges and promising opportunities for global health. The region continues to face the evolving risks of infectious diseases, the realities of demographic change, and the persistent gaps in access to care. By 2050, 1 in 5 people in the Asia Pacific will be over 65, while non-communicable diseases will cause more than 80% of deaths. This underscores the need for stronger, more adaptable health systems. These challenges also show how innovation, when combined with cooperation and shared commitment, can open new opportunities. Innovation without equitable access cannot deliver its full impact. Access without innovation may fall short of sustaining progress. The World Bio Summit theme, From Innovation to Access, Health Innovation for Everyone, Everywhere, complements APEC's own 2025 theme, Building a Sustainable Tomorrow, Connect, Innovate, Prosper. Both emphasize the importance of ensuring that advances in areas such as artificial intelligence, biocluster development, and age tech bring meaningful benefits to communities across our economies. Yesterday's APEC high-level meeting on health in the economy reaffirmed the value of dialogue on ministers on regional health priorities. Today's summit offers a mutually reinforcing space where public and private partners, together with the academia and civil society, can consider practical ways to translate these priorities into collective action. APEC remains committed to supporting these efforts by facilitating policy dialogue, building capacity, and fostering cross-border collaboration. Let us take this opportunity to forge partnerships, mobilize financing, and map concrete steps that move ideas from pilot phase to everyday practice. I extend once again my gratitude to our hosts and partners. I look forward to these conversations ahead and to working with each one of you to ensure that innovation truly delivers health for all, everywhere. I thank you.
Thank you very much, Mr. Pedrosa. Thank you very much for highlighting that these two global platforms, share a common vision. Thank you very much. And ladies and gentlemen, let's give a big round of applause to all of our distinguished guests who just shared their meaningful remarks. Thank you. Please give them a big round of applause. Thank you. At this point, following the remarks of our esteemed guests, we are pleased to share a special video prepared for the opening of the World Bio Summit 2025. The video showcases how advanced medical technologies in daily life and globally connected healthcare systems work together to protect health worldwide. It envisions a future that crosses borders, safeguards people of all ages, and carries hope across generations, values that the World Bio Summit upholds. Created with anamorphic techniques, this video will provide us a unique 3D experience that blends reality and virtual. Ladies and gentlemen, please enjoy. Let's draw your attention to the screen.
We live in a world where medical technology has become deeply embedded in our daily lives. Digital healthcare captures even the slightest blips in our health status. A single alert can serve as an important red flag, helping to protect us from potential health risks. Even in our daily hustles, our bodies constantly send out signals. Technology listens on our behalf and shares them with us. Health is not about big things. It begins with the simple habits woven into our daily lives. Built on data and innovation, medical technology offers guidance we all need. Even the slightest signal can spark a transformative change. Today, we stand on the journey toward a healthier future. A world of health for all, built on technology and innovation. A journey of health from prevention to diagnosis, care, and treatment. The World Bio Summit stands in the center of this promise.
Ladies and gentlemen, once again, please give a big round of applause to mark the successful opening of the World Bio Summit 2025. Thank you very much. So the video that we just shared to all of you now shared the core message of the World Bio Summit 2025, bringing health innovation for everyone, everywhere. Thank you very much for watching this video together. And now let's carry this inspiration into today's sessions. We will now take a brief moment to prepare the stage for the upcoming session. But before that, once again, we'd like to extend our sincere gratitude to all of our distinguished guests and participants from home and abroad for gracing us with their presence. Your participation makes the beginning of this summit all the more meaningful and special. Thank you, and please stay with us until the very last moment of today's event. While we set the stage, ladies and gentlemen, we like to introduce what this session is about. This is a dialogue between our leaders. We will focus on overarching theme and vision of the World Bio Summit 2025. And this dialogue session will be conducted as a fireside chat between the chair and our esteemed panelists. We hope that it will provide valuable insights under the theme, from innovation to access, health innovation for everyone, everywhere. Ladies and gentlemen, we'd like to invite our distinguished panels as we are ready to welcome them. But before that, after having this leaders dialogue, we will proceed with the session 1 here in this room. And we do have a session 2 at the Dynasty Room number 3. And please come back to this hall if you want to join session 3 and the closing session. So once again, we hope that you can engage very well throughout the sessions. We wait for your active participation until the very end once again. So ladies and gentlemen, under the overarching theme of this year's World Bio Summit, from innovation to access, health innovation for all, we'd like to now welcome our chair and esteemed panelists to the stage to join this leaders dialogue. And this session will be moderated by Dr. Brandon Hall, CEO of Lunit. So ladies and gentlemen, let's welcome them to the stage with a big round of applause. Our moderator and esteemed panels, you may please come up to the stage. And ladies and gentlemen, let's welcome them with a warm round of applause. Please welcome them. So please take your seats on the stage. Thank you very much for sparing your valuable time to be part of this meaningful dialogue. Thank you. Please take your seats. And ladies and gentlemen, with that, we'd like to once again welcome our moderator, Dr. Brendan Saul, CEO of Lunit. He will be guiding us through this Leaders Dialogue. Once again, please welcome our moderator with a big round of applause.
Thank you, everyone. Good morning, everyone. Very an honor to be here leading this session. So for this session, we'll be talking about technology, health innovation, and how we can scale that out globally, with also the notion of having to also address an important issue that is access and health equity. I'm Brandon So. I'm leading Lunit as Chief Executive Officer. At Lunit, what we do is we use artificial intelligence to conquer cancer. That is our mission. We have commercial experience over 5 years. We are deployed in more than 10,000 sites throughout the world, in over 40 countries. So we do have some first-hand experience trying to not just develop technology, but also having it adopted to various countries in the world. I'm delighted to first introduce to you 4 distinguished guests. Dr. Philippe Dunton, Executive Director of Unitaid. Ms. Penny Shakespeare, Deputy Secretary at the Australian Department of Health. Professor Kay Zhou, Professor of Neuroscience at King's College London. And Mr. Christian Rothsels, Managing Director at Johnson & Johnson. Thank you for your participation. So for the first question, I'd like to ask each of you is, for innovative technologies like AI, what do you think is the key for scalable adoption? And maybe we can start with Dr. Dunton.
Thank you, and good morning, everybody. I want to thank the Republic of Korea for inviting me here and organizing this bioforum. I attend most of them, I think, and it's always a pleasure to be with you. Look, AI is part of our life now, we like it or not. And what we can expect is what we expect in terms of innovation is the transformative impact that AI has as a potential. Yesterday, we were with our colleagues and from KCDC, and we invited an example we had in digital health to have a company named Fucom who had a portable device to make X-ray. When I was a kid, I had X-ray to detect TB, you know. But this portable solution is much more cheaper and can be used even at home care. But it has a component on AI. And so, of course, as you know, radiography, AI is now definitely more advanced than any doctor like me. So if you see that kind of potential, if you see that the help that doctors can have through AI, sky is the limit. It can represent challenges, but I really think that we have to recognize the potential in all parts of the activity in terms of access. I mean, realize that I'm also pushing for responding better to pandemic situation. Today, we don't have the vaccine, or we don't have the drug that can cover the threat that 8 families of virus may put according to WHO. We need to detect new compound. The way to do that is to do screenings, for example, with AI. So just to illustrate that it covers a huge arc of discovery and innovation. This is part of our life, and we need to be more decisive and more proactive into that. Thank you.
So you mentioned about some new technologies that can have good potential. Actually, another question for me, following up, is what about the more realistic perspective about how is it funded, how can it be adopted especially in the middle and low income countries? How do you think that should be addressed?
I think that the second point that we have learned over the 20 years of work at United is that you need to think about the people. Systems are important, of course, but the most important part of access to innovation should be patient or community-centered. And in that perspective, everything we do is also, for any intervention, we talk about the people. That's the challenge I see global health, because it's not the global health that matters, it's the transformation of life that people have. I think that United has support access to more than 320 million people every year. It's a question of savings, more than $1 billion a year. This is access. So coming back to your question about artificial intelligence, if you think about the people, you have a huge leverage to transform the system in a way that it's more self-patient centered. For example, coming back for the example of the COVID-19, self-test has been a breakthrough because, in fact, if you decentralize access, you increase impact. And so the way to think about innovation is to really think about how transformative you can be, and whatever it is, self-test, access to medicine, of course you need professionals to organize that. But AI could also be transformative when you think about what can people receive from that.
Thank you for that. Maybe we can move on to Ms. Shakespeare. You have experience in the Department of Health of Australia, assessing various technologies and choosing and maybe adopting it across the country. Maybe share us your perspective and your experience doing that.
Thank you, distinguished colleagues. It's a great honour to represent the Australian Department of Health, Disability and Ageing here today and to share our experience, which is really framed around our deep commitment to universal access and equitable access to healthcare. So all of our work across data and digital capability, the assessment of new therapies, the development of capability for local manufacturing of advanced therapies is really framed around how do we need to ensure that what we invest in through these technologies is benefiting the entire population. And we want to share our experience with our global partners to make sure that we achieve the objectives of access to better healthcare for everyone, everywhere. So in terms of our investments in data, that's been particularly involved in setting up national data collection, which is patient-controlled. We have a 13-year-old national electronic record system, which patients decide whether or not, firstly, they want to have one, and secondly, who can access that information, and it's patient-curated. We've recently made efforts through our Parliament to ensure that laws will require health providers to share information to that patient's record. So it's the patient that decides whether or not information about their health interventions goes into that record. That's increased massively the amount of information that we can share with patients about their healthcare. It reduces the time that they have to spend sharing their healthcare story with multiple care providers, and it allows us to establish virtual care teams that take better, efficient workforce teams delivering primary care, community care that don't need to be in the same place at the same time. We've also invested through our public insurance system, Medicare, in telehealth and virtual services, which is very important for a country like Australia, which has a very geographically dispersed population with 1/3 of our citizens living outside large cities. So increasing virtual care for them has been quite revolutionary in ensuring people can access specialist medical care and get better coordination of their care. I've also been chairing for Australia our Health Ministers Collaborative, which has been established, the Health Technology and Genomics Collaboration, which is helping us work to translate what we have been investing in and considering in terms of advanced therapies from clinical research and trials into standard clinical practice across our different health services. So that involves representatives of all our Australian governments working together to set up the building blocks, whether it's safe governance around data, collective decisions about where advanced therapies such as cell and gene manufacturing, viral vector manufacturing will occur for the entire population, but making those sensible decisions to ensure that we will have affordable, efficient and equitable access to innovation.
Thank you. We'll move on to Mr. Rotsets. You represent Johnson & Johnson. I believe that you have a lot of experience, not just on the drug discovery side of things, but also scaling out the distribution of the products and of the pharma companies throughout the world. Share us your insights, please. Thank you.
Thank you for the question, and good morning to everybody. Firstly, I wanted to share a personal story. I recall I was 13 years old, and just before I went to bed, my dad walked in and let me know that my grandmother had passed away. And I didn't know that she had lung cancer. And I remember when I joined and chose to work for J&J, I realized that it's a company that for the last 140 years have been focused on bringing innovation so that we can preserve life. And I do think about AI, and I think within J&J, we now have the ability to screen millions of drug targets a lot quicker than we would have in the past to be able to identify what is the right target to go and identify and target with a pharmaceutical product. And we're moving into a new era of precision medicine, and we call it the precision medicine era, where you'll be able to go into a physician's room, identify what gene or what target needs to be addressed, and you should get a personalized medication that will be provided to you. And at J&J, what we're striving to do is to be able to seek areas where the unmet need is significant. And one of those is lung cancer. Many of you know this statistic, but 1 out of 5 people die within 5 years of a lung cancer diagnosis. And that was my grandmother. And there are many other examples of prostate cancer, bladder cancer, that we are using artificial intelligence within our organization to identify where do we need to go. Can we accelerate the bringing of these medicines to the market? Because we know that that's a costly exercise, one that is incredibly high risk. And in my experience, I've seen many amazing drugs fail after 10 or 15 years of work. And artificial intelligence will allow us to actually be able to bring those sooner. And one of the important things I think when we talk about AI is it's not, I resisted the idea of the concept for a while. until I realized how powerful it is. Several times this week, I've been using AI to help me prepare for meetings and discussions. Just before this discussion, I searched the meeting, and it told me that I was part of this panel with all these distinguished guests. And it's so incredible if you just allow it to move your organizations forward. So we will continue to use AI so that we can make sure that people are able to experience their grandparents, because we've been able to bring products to the market that make a significant difference for people's lives. Thank you.
Moving on to Dr. Zhou. Before we started this session, you mentioned that you had some perspectives on some being a little critical regarding AI. I think we welcome those kind of discussions. I think you have a background on the research side of things, so please.
So one of the benefit of academia is we can say whatever we want to say, okay? Because industry have a lot of limitation and government bodies, again, policies. The professor is very much, I want to say what I want to say, okay? So AI, no doubt. There's an opportunity and future is there, and innovation and accessibility, there is no doubt. So for example, Christian, you mentioned about the drug screening, okay? So one example, more than 10 years ago, we started drug discovery as a conventional way, and then apply start with the data mining and AI predictions. So actually, at the time, I went to the Johnson & Johnson and said, well, guys, I have a great item here, and this is a very good drug target. The first question was, what about BBB? I said, no idea. So, okay, forget about it. So we back to the lab, and then we're designing that compound. So we don't know how we got that far, but prediction was, AI prediction is like 80%, more than 80% chance the compound can cross the BBB, which is like not other organ, the brain, because I'm working on the neuroscience and brain target. If BBB is not available, and then just forget about it. So, well, several years later, and we realized that the AI prediction was absolutely correct. So now a lot of global farmers, they just asking me, oh, okay, can we have some more discussion? I said, well, too late, because we're going through another stage. So this is a very good, the positive side of AI. But I would like to say more fundamental point of view. So as I said, no doubt, great. Now, let me put this way. If someone wants to make a very good Japanese sake, the sake has to be very fundamental. One, very good rice, and very good enzyme, and very fresh water, okay? So AI require these three components, so-called junk in and junk out. So most of data available, but still there's many of a mixture and message. This is a life science problem. The reason because life science still working in analog systems, not digitalized. So this is a key issue, how we actually transform this analog generation of life science turn over to the digital generation. For instance, a lot of genetic informations, a lot of protein informations, a lot of data and publications. But AI, if you look at even myself, I asked to AI my previous publication. AI make some criticism, and we look back, and we actually identify, well, that was our mistake to make this a statement. So we have to be more cynical and more neutral point of view, and think about how we can actually develop and contribute our future and healthcare and so on, particularly drug discovery. I think that is what in this world, but everybody, we should think about AI is a great opportunity, but we have to be very careful about how the data so far is eligible or compatible with AI as a digital generation. I think there's a big question mark. The other side of the coin is the life science is a fundamental, but if too much emphasize digital generation, who will collect more biological data? So-called, I think today I'm a bit ashamed because the WHO, the Director General is not here, but over the COVID, same as like Mr. Zhang, at the time he made statement, test, test, test. So same thing, AI generation, I think validation, validation, validation. I think this is a key message we have to sort it out in the future.
I think in this context, I believe health equity is a very important topic. Giving access to, even though we develop these technologies, if it's not accessible to the wide population, it becomes less of value. Perhaps let's conclude the session with maybe the panelists saying a few words regarding your perspectives on health equity. Maybe start with Dr. Dunton.
Yeah, sorry, can you repeat the question?
Your perspectives on health equity. Health equity.
Yes.
So giving more access to the people.
Look, equity is in the art of what we do as UNITED. I was not expecting to talk about my grandmother, but here we go. The brother of my grandmother died 100 years ago from TB. But during all my childness, my grandmother talked about this time that his brother of 20 years old, his favorite, died because he started to cough and lose weight, and finally died very rapidly. So I think it's a shame that we have still tuberculosis. I know it's a priority for Korea, but it's a priority, it should be a priority for the world. We can complain, but the reality is we have developed, and UNITED has done its part, to develop new drugs, including drugs for kids. There was no drug for kids when we started. The diagnostic, and I was talking about screening for X-ray. Anyway, no excuse, we need to do that. And we will have a vaccine. If we have the money to invest, to develop, but we have 3 good candidate vaccine coming in the next 5 years. I took this example because equity is the way to take care of people that nobody cares. And I think that the beauty of innovation is to think about the people, our 320 million people that we serve, because the counterfactual is they need to have access to innovation, and if we are not there, they will not have it. So everything we do is driven by equity. Thank you
very much. Ms. Shakespeare, maybe you can have a few words from a government perspective.
Thank you. I think the opportunities of AI are so diverse, we probably don't even comprehend them all yet. And, you know, as well as really important drug development, vaccine development, advanced therapies, personalised medicine, which really, you know, is going to depend on our ability to maintain public trust, because we need large whole genome sequencing data sets to take full advantage of that. But there are other benefits that we may potentially lose. We will be able to more effectively train our healthcare workers. I'm really looking forward to a time when we can have AI and robotic supervision of our new health practitioners so that they're not it's not such a distraction from the more experienced clinicians in training them. We'll have digital clinical decision support tools for people so that they don't need to do quite so much training up front. It will be genuinely revolutionary for healthcare. But in order for us to achieve that and to ensure that we do have health equity, we are going to have to make sure that we've got robust governance frameworks. Because if we lose the trust of our populations in how we are taking their data, and it can be the most essential personal data that needs to be used to take the full benefit of AI, then I think we have lost the benefits that we could potentially accrue to our health systems and broader economies. So we really think it's so important that we all have collaborative discussions around the ethical adoption of AI, that we've got robust governance frameworks. Australia has been actively participating in the Global Partnership on AI, and having the transparency, the public understanding, the conversation with our citizens to make sure that they understand and are part of the journey is really important to achieve equity in access and the benefits that we can accrue across so many different parts of the health system.
Thank you. Unfortunately, we are out of time. I think with technology like AI, we truly believe in the potential. I think we all believe in it. I think it's very important that other multiple sectors collaborate for that to happen, to these innovative technologies to actually reach patient care. So thank you very much for your attention. Thank you. Hope it was a fruitful discussion for you. Thank you.
Thank you. Let's give them a big round of applause. Please now return to your seats. Thank you. Thank you, Dr. Seo, for leading this meaningful dialogue, and thank you to our esteemed panels for joining us today and sharing their valuable wisdom. So, ladies and gentlemen, we just listened to meaningful dialogue covering the vision of the World Bio Summit 2025. So, as the theme of this year's World Bio Summit, under the overarching theme, from innovation to access, health innovation for all, we hope that our upcoming sessions will serve as a meaningful global platform to share wisdom on inclusive health innovation. And ladies and gentlemen, based on the overview and the guide that we just shared at this Leaders Dialogue, today we will cover topics such as health AI, biocluster, and aging and health technology. So ladies and gentlemen, please stay with us until the very end. And now, to mark this special event, we'd like to take a group photo shoot with our distinguished guests. So once you hear your name, please come up to the stage and join this photo session. And ladies and gentlemen, we will begin session 1 momentarily in this room. So please remain seated in this room. Thank you very much for your patience in advance. With that, we'd like to now welcome our distinguished guests who will be joining this photo session. First and foremost, we'd like to welcome Her Excellency Dr. Jong Eun-kyung, Minister of Health and Welfare of the Republic of Korea. Please welcome her once again to the stage. And next, Mr. Park Joo-min, His Excellency Dr. Mustafa Ferzani, please come up to the stage. And Mr. Eduardo Pedrosa, we'd like to welcome you. His Excellency Mr. Khalid Arvrikan, Deputy Minister of Kingdom of Saudi Arabia. His Excellency Mr. Trituk Eung-yen, our Vice Minister from Vietnam, please come up to the stage. And His Excellency Mr. Penioni Lavnawa, Deputy Minister of Fiji, we'd like to welcome you. And Philip Duntong from Unitate, we'd like to welcome Your Excellency. Please come up to the stage. And our distinguished guests who are sitting in the first row, please come up to the stage following the guidance of our staff. Our esteemed guests who are sitting in the first row, we'd like to welcome all of you. Please come up to the stage. And now we'd like to welcome our esteemed guests who are in the second row. Please come up to the stage. Our guests who are sitting in the second row, we'd like to welcome you to join this meaningful photo session. Please come up to the stage. And our Leaders Dialogue panelists, please come up to the stage. Our moderator and esteemed panels of Leaders Dialogue, please come up to the stage. And representatives of each diplomatic mission, please come up to the stage and join this photo session. So ladies and gentlemen, if you're wearing jacket, please fasten your jacket. And can you please make sure that your name tag is on your jacket, that we can see your names as well. Thank you very much for your kind cooperation. Yes, we will take one perfect family photo together in one frame. So thank you very much for your cooperation. Thank you. We're now ready to take perfect photo. So please look at this camera. We have a center one with your bright smile. 1, 2, 3, smile. Look at this camera. Thank you. And next, let's make a little finger heart with your thumb and index. Yes, that's perfect. Look at the camera with your heart and your smile. Once again, smile. 1, look at this camera, please. 1, 2, 3, smile with your heart. Last but not least, this is cheer up with your right fist. Not fighting each other. It's like, let's go together for this year's World Bio Summit. Okay, with your fighting pose. Yes, yes, that's right. Look at this camera. World Bio Summit. Fighting! Maintain your pose and smile. Thank you very much. Ladies and gentlemen, please give a big round of applause to our esteemed guests. Please return to your seats. And ladies and gentlemen, Her Excellency Minister Chung Eun-kyung of the Ministry of Health and Welfare of the Republic of Korea will now leave the hall. Once again, we'd like to express our sincere gratitude to Minister Chung for her leadership. Let's give one more round of applause to Minister Chung as she leaves the hall. Thank you.